Hello, everybody, and happy Thursday Night Live. I have been waiting patiently for this webinar. Dr. Chow Chow Wang has been a member of the Airway Circle Professionals group on Facebook. So if you guys are not a part of that, please join us. But she has shared so much incredible information that I was like, you need to come talk to us because we don't have enough optometrists, and she's a behavioral optometrist. So my goodness, I know that there's so much that is related that we don't even know yet. So first of all, thank you so much for being here with us today.
Sorry.
And then I'm going to go ahead and introduce her. She'll be able to share the screen. As a quick message, this is being recorded September 12th on a Friday. If you're not an Airway Circle member, you may be here with us live. So please ask your questions in the comment box, in the chat box. And if you're watching this recorded, we're planning to play this January 8th. So if you're an Airway Circle member, you have access live and immediate access to it. Right after this, it's going to be in the membership portal. So anybody else who could not be here with us live, you can go ahead and go watch. However, for everybody else, you guys are going to have to wait until January, but it's going to be a good talk. So anyways, and we are, for those who are here live, I'm not going to share because it's going to play in January, but we have a specials going on celebrating our 4-year anniversary for September. So if this is in January, we would have just started Foundations 3.0. So if you still want to join, maybe there's still a little bit of time, reach out to me and we'll see if we can come in. And then our advanced course is going to be Myo Circle in August of this year. So stay tuned for anything else Airway Circle is bringing to you. Alrighty, everybody, introducing Dr. Chow Chow Wang, a behavioral optometrist and former biomedical researcher with a Ph.D. in cell biology and a Doctor of Optometry degree. She integrates vision care and whole body health, focusing on how vision impacts sleep, breathing, development, and learning. In her practice, she offers behavioral and syntonic optometry, treating conditions like binocular vision disorders, post-trauma vision syndrome, and learning-related vision issues. Dr. Wang is also an educator and an advocate, passionate about the connection between vision and quality of life. Today's topic is vision beyond sight, shining light on sleeping and airway health. Welcome to the Airway Circle stage. You are welcome to share your screen.
Great, thank you.
And if anybody wants to reach out to you, you're in Connecticut?
Yes, I'm in Connecticut.
Yay. I'm going to share a little bit of this. I should have shared earlier on Facebook.
Great. Can you see the screen?
We can see the screen. Thank you.
Very good. Thank you for having me. I feel so much honored to be here, share what I have learned in last 15 years practicing optometry. So thank you for your wonderful introduction. Let me just scroll. So I don't want to, repeat my introduction. So I have no financial disclosure for this presentation. So I just want to share my passion and what I have learned. I'm so thankful for I can standing the many shoulders of many pioneers and giants in field and share what I have learned. And I'm also a proud mom of 3 children. They are my teachers. They are motivation for me to learn, out of my limit. So I'm always like asking questions, challenging, what I have known. So yeah, I learned so much from them, just watching them growth and development, and especially vision development, which is brain development. So of course, my patients who trust me dearly during the process, and we share in an office informations, and we just working together, and we see the life-changing result both for them and for myself as a provider. Very thankful for that. Without further ado, I would like invite you to ask yourself questions. These 3 questions. What is vision? Why we have vision? What's the purpose of the vision and how vision connects to other part of body, especially the airway and the sleeping medicine. So hopefully by end of this presentation, you have better idea what is vision about and what's optometry care about. And I hope also can further your understanding of what's vision. So today we are focusing on vision. I'm going to present what really vision symptoms looks like and neurology of vision and airway and sleeping medicine, optometry tools, what make special or unique as optometrist, how to collaborate with other profession, and hopefully I have time go to a case. So when we talk about the vision, a lot of people will, sorry, this is not, do they? Okay. A lot of people will tell me, I can see 20/20. I have perfect vision. My eye doctor tell me I have healthy eye. I can see 20/20. There shouldn't be any problem with my vision. I would challenge that. So if the person can see 20/20, but the eye movement cannot help them reading, so the people with the eye movement problem were reading like that. So the words jumping around on the page, then nothing, they make sense to them when they're reading. So what happens if the patient has no accommodation problem, as a poor accommodation problem? They read like that. The words going in and out of focus. So when the vision or the eye cannot focus in them, the mind cannot focusing. So what happened, the patient with the eye team problem, they starting seeing this, the words become double and a single, keep just moving around. So what those symptoms can do to the person, they starting report the words moving on the page, things getting double, and they cannot focusing, and then they cannot understanding what they read. They cannot remember what they just read, and the skipping line, loose place is very common complaint of kids struggling in the school. So behaviorally, you will see they avoid reading at all costs. And when they ask do you like reading? They said reading is so hard, and they have poor attention span, headache, dizziness after school. So what else this can do to a person? So those person were starting thinking, I'm stupid. I cannot learn anything. I just don't understand. And they starting have anxiety in the school or anxiety at work, and also have develop depression because they just cannot learn as other people they know. So today I'm going to define the vision for you. Vision is much, much more than 20/20 eyesight. So what's the 20/20 means? The first 20 means 20 feet. You are standing in the 20 feet distance and you look at this chart. This is very familiar chart for a lot of people. You can see that in eye doctor office, school nurse office, and the pediatric office. And that 20/20, the second 20 means you can see this size of the letter at 20 feet. That's the 20/20 means. That only measure the visual acuity or eyesight. But today I'm talking about vision is about how we see the world and how we interaction with the world around us about what you see. So vision is our human major sense. It also integrates with the other visual sensor organs like smell, auditory and touch. So vision is also motor. Vision is not something that happened to you. It's you have to do the vision. So when you wake up, you open the eye, the first thing you see the light, and you starting processing what you see. So this is the vision. You are doing the vision when the eyes open. Baby are not born with vision. Vision is a set of skill you have to learn and develop through the movement. It's very important. You have to learn the vision through movement in a 3D, like in real 3D environment. So here, what I'm talking about, the so you can see eye doctor for annual comprehensive eye exam, which is very important because eye is a window of the health. We see through the pupil, the eye, and we can see the vascular structure change due to the diabetes or hypertension. Optometrists, sometimes we are in the first line to catch those things even before the internal medicine lab blood work tell the patient. But comprehensive eye exam, it does not guarantee your both eye can working together. I'm sorry, my video is off. Let me see here. Sorry. Okay, here we go. So now, if you can see 2020 and the eye health is okay, good. So, but that doesn't guarantee your both eye can work, properly. So, as a behavior optometry, we look at the eye movement scale, the accommodation scales, which is focusing scale, and the both eye coordination scales. And also we look at the peripheral vision processing. I'm going to talk more about those peripheral vision processing. And the vision information processing skills, depth perception, visual spatial processing, visual motor integration, and visual vestibular integration. There is 30 vision skills that are essential for learning and daily task and keep you feel safe in the space. So what is the vision? Dr. Scaffoldon is a father of behavior optometry. So he said vision is a learned skill that emerges. So he proposed a vision model called a full circle vision model. And I have no time to go in detail about that. A lot of behavior optometry, learn this model and expanding on top of this model after they practicing them optometry. So if you end up in different behavior optometry, so they have same foundation, but they practice quite differently. And Dr. Robert Kreisking is another pioneer in behavior optometry. He said vision is to derive meaning and direct actions. So human vision is actually an intelligent, active, and constructive process, not just passive perception. Vision involves the brain interpreting sensory information from the eyes and integrating the information from other senses to understand an interaction with the world, constructing a useful visual representation of it, often unconsciously. Actually, I take this from the AI and I just adapt to it. This is I adding that. It's the vision is our interpreting sensory information and also integrating the other information and then become the vision. So here I'm inviting you to look at this picture. What do you see? Do you see a duck or do you see a rabbit? In order to understand my question, you probably have to generate an image, visual image, a duck and a rabbit. Then you can match your visual image to this picture and you tell me you see duck or rabbit. So vision is based on your previous knowledge and experience. And then I'm going to invite you to look at this picture. You probably see this picture clearly. It's not blurry to you, right? You can see it, but what do you see from this picture? Can you make a meaning of it? So if I tell you it's an animal, can you tell from this picture? So this is a very famous racial cow. It's a cow. If I doing this and I come back there, now can you see the cow? So this is a demonstration is telling you vision is much more just seeing clear in 2020. So here is our pioneer optometrist, Dr. Larry McDonald said, the eyes do not tell people what they see. The brain tells the eye what to looking for. Here the slide, I'm going to spend a lot of time to this. So this is retina. And if you do the eye exam, your doctor might show you this picture to you. This is only like a very central part of retina. And this is the area is a dark pigment. This is the macular. This area is responsible for the central vision system. Compare all the peripheral vision and this central structure. This only have 5% vision. So central vision, and also I keep that in mind. Each point of the retina is all the brain cell. It's the neuron. It's not enter into the retina. It is. It also go to all the areas, different areas of the brain. So basically, these cells starting in the retina all go into the brain. So all the cells on retina is go to all part of the brain. So the eye is a part of brain. So in the central vision system, in optometry, we call the central vision system. But in the vision processing, we also know is a ventral vision process. It's contribute to what pathway? 5% of vision is contribute to that. Carry the high resolution of fovea information only from here, fovea macular. Responsible for object recognition, discrimination of size, shape, color, brightness. It's a slow process. It is I see it. So I mean, I see it not means you see it clear, you understand it, right? So this is the system is corresponding for what you see. So there is a big chunk of the retina outside of macular, that's 95% actually responsible for peripheral vision system. So in the vision processing, this is contributed for dorsal where pathway vision process. It's subconscious and responsible for object localization, visual targets present in the peripheral and drive sensory motor control, motor plan, and motor processing. That's very fast processing. It's like, I don't know why, but my gut feeling telling me to do this. So it's subconscious. So these two systems has to be integrated properly to make one feel safe in the space. And peripheral vision also keep us safe. If we only operate on the central vision system, which is slow processing, our human won't be exist. So peripheral vision is help keep us safe in the space and detecting the dangers all the time. So since all the retina here, this is you can see this is the eye, the whole eyeball. This is actually the retina here, the peripheral retina, and that is if you do the light here, this is the macula only very small amount. But all this retina is goes through the optic nerve and go all area of the brain again. So vision involved the whole brain. Think about the cranial nerve. 7 out of 12 intervenes the vision system directly. Cranial 2, 3, 4, 5, 6, 7, 10. Most of these nerves are localized in middle brain or brainstem. And vision highly regulated by the autonomic nervous system. And every lobe in the cerebral cortex involved with vision processing through visual and non-visual pathway. We do use this pathway and in our treatment plan by prescribing lenses. Cerebellum is involved in vestibular ocular reflex. Pause here, anything inside the brain, it will impact the vision in some way. Vision is a major sense. It is an integrated brain process. There is no vision in the eyes. Eyes are just collecting light information. All those retina cells I'm talking about is called the retina, the light receptor. Vision integrates the various systems through the brain through primary visual pathway and non-visual pathway. Auditory, speech, language area for communication. Vestibular proprioceptive centers for posture and move in the space without bumping into the the object. Cognitively is vision information processing. Intercentric is like a body awareness. It's very important for you to feel your body and you do the vision. Emotion, vision has highly related to the emotion regulation and attention, vision attention engagement. So vision care should be a multidisciplinary approach. And we work with an extraordinary, network to help our patient. Shouldn't be like just, optometry. So vision problem can be misdiagnosed as a learning difficulty, behavior problem, attention problem, and a mental health problem. Does that sound familiar for you guys? I recently heard reading about the obscure sleep apnea can be misdiagnosed as attention problem. So those diagnoses actually heavily relied on the behavior and the symptoms. But this is all the diagnosis is only about the symptoms. So if the auditory person, like a speech therapist, come in, they said ADHD or this diagnosis could be the auditory processing problem. When a developmental practitioner comes in, they said ADHD or dyslexia or this behavior problem could be primitive reflex problem. And if a nutritionist come in, they said, oh, this is because nutrition problem. But everybody are right, they are all the problem in these areas, all contributed for these symptoms. But to me, from my practicing and working with those patients, I think it's all about imbalance in the system, in the nerve system, or maybe in nutrition balance. But I think everybody has their own, area can work on. So we should work all together. So I don't think vision is more important than other systems, but I think vision can give us some detective, symptoms. It's like a detective, why they cannot attention, why they have this behavior. So this is Dr. Gazelle, actually is a pediatrician. He actually trained our giants in optometry in the Child Development Institute at Yale. So he said, to understand a child, one must know the nature of his vision. Then we can understand why the children, behavior. So I use different vision symptoms checklist for different patients. So before I make appointment, I asking a lot of questions and I handpick my intake forms for different patients. So as I knowing more and I try to, understanding the whole person, my intake form has like 10 documents. And everybody is different. Is intake form. So vision involved in eyes, brain, body, mind. Over years practicing of behavior and syntonic optometry, I started to see some patterns in my patient population along with visual complaints. Those patients, especially pediatric patients, they have allergy. They have food allergy, have an environmental allergy. So they come to me, most of them, they have congestion. History of recurrent ear infection. For syntonic optometry, this is a red flag. That tell me that vision development will have some defect if they have recurrent ear infection. History of enlarged tonsil and adeno, and some patients they come to me before they removal. Some patients already have been removed sometimes for several times. Tooth decay, poor breathing habit, and oral posture. TMD in adult, if you ask how sure, they said that they have TMD problem. Sleep apnea, adult already on their CPAP. Poor diet. So one of my intake form asks what's your child's behavior when they feel anxious. So a lot of time the parents will share is sucking thumb and biting nails. Constipation, diarrhea, or some gut issues, trauma, head trauma, any kind of emotion trauma, childhood trauma, development delay. So all this is a very common report in my intake form for my patient. I think probably you find this very familiar in your intake form too. So as I treating those patients for the vision problem, vision symptoms, I use syntonic as my first line. When they come back, they report very, dramatic, but I'm not surprised because the syntonic is balanced the autonomic nervous system and open the visual field. But what they report is not only they, skipping line lost place. They reporting is, oh, the self-esteem getting better, or the congestion is getting better, or sleeping gets better. So I'm just questioning myself what I'm treating. So I realized actually I'm treating neural inflammation and a mitochondrial dysfunction. That's all the light, designed for. So vision, eye is a part of brain. Vision reflect the function of the whole brain. So I sometimes I would just try to figure out why and how my treatment can help with the other areas, especially sleeping. So I go to the basic, the nutrition, oxygen, light. If we have the proper nutrition, proper oxygen supply to the brain and the light, it's for the proper brain function. So I will look at the pre-birth and the birth process, any trauma down there, any stress during that time, malnutrition, food addictive and lives and ultra processing food, and even the medicine will inhibit some nutrition absorption. Malillumination. This is probably new to you. We know junk food. We know there is a pollution, but those artificial light is we call the malillumination. So if we expand our indoor artificial light, there's so much research has been shown those light is not good for us health. It's disrupt the endocrine system. Toxicity, the pollution, chemicals, pesticide in around us. Trauma of any sorts, physical, emotion. I think I heard sitting in several seminar from Air Circle professional. We talk about micro trauma and macro trauma. Stress. I'm looking at the family dynamic change and the school, stress, the peers, bullies. Vision stress, poor posture, poor airway pathway, sleeping habits, and anything combined about what affect the brain function and some will affect, have present as a vision symptoms. So after I understand this is my approach. I only speak for my practice. So my approach to, to treat this vision development and rehabilitation program, I have to understand how they function visually, how their brain function, and identify vision problem. As optometry, we only treating vision problem. The patient come, with the diagnosis of ADHD and dyslexia. After treating vision problem, they're getting better. I don't claim I'm treating ADHD, but I only treating the vision problem. So my first line is prescribe a pair stress relief lenses. I will talk about more about the lens prescription. And then my first line is syntonic. As I told all my patients, if you are chasing that tiger, you are fighting flight, I cannot teach you anything. Your nutrition won't be absorbed properly. So I have to calm down your nervous system with my light therapy. And then we can look at what else we have to work. So after syntonic, based on my testing in this functional visual field, I make a referral. And then I also offer in-office integrated vision therapy. So I'm going to share with you stress. Everybody, I want to take out your just arm. Sorry, my camera is so not working. I want you just to call
Oh, be able to demonstrate.
Demonstrate. I will just extend your arm and put the thumb up. You can use the pencil like this too. But let me see. How can I don't know. My video
No
sometimes.
glass. There you go. We can
So
see
put
you.
out your arm again. Yeah. So I don't know what happened. It happens. Yeah, just like this. Open. Put the thumb up and look at the thumbnail. Okay, and I'm going to how you feel, what you see, and what you feel in your eye. Just look at thumbnail at arm distance. What do you feel? If you already feel tense on the body, on your eyes, that tell me you do have the converging the problem. You have to call the behavior optometry. But most people, they feel normal at this distance, arm distance. Now I'm going to have you keep an eye on the thumbnail or the pencil tip. I'm going to have you pull your pencil or arm like close to you, or and what do you feel your eye? What do you see? What your eye? What you feel? Sometimes you might see double. You may be blurry. What do you feel is your eye is toggling? Do you? Then I'm going to have you pay attention to your face, pay attention to your breath, your teeth, while you're following the eye to your nose. This is a very good tool to demonstrate how vision stress is, and you can do a screening on your patient. See, can they do those converging scales? They have good converging scales. For this one, a pair of stress relief lenses and the visual hygiene is very helpful. Okay, so let me show you what vision stress can bring the change of the oral and the posture. Look at that. So when we cannot see, so I have my patient sit in my chair and I pull out my the visual acuity chart and I have them read. All of a sudden they have head forward and squinting and just with all the facial like tense or the face and crunching teeth and even mouth breathing. So this is what happened when the visual stress and on the computer like this. So they starting, open the mouth breathing, look steering, right? And apparently I was thinking because it's behind the screen, I think the teeth were crunching. Think about those people in this posture, 8 hours in front of computer, because they become the habit. It will have a problem when he's sleeping. Again, function and structure. Another thing I will keep in mind, if you work with a patient in your therapy or in your evaluation, if the patient wear a pair of glasses, ask them what the glasses used for, prescribing for. If the glasses come from the comprehensive eye exam only for distance 20/20, those glasses is not good using on a computer for long term because any lenses will change the brain. I just told you. So and if the patient have a progressive glasses which make there's true focal, this is for distance and all down, gradually they have the lenses for the near or intermittent distance. Look at those patients, they try to use the posture and looking through these areas for computer for the clearness, and look at this posture. So in this case, I would recommend then come back to optometry. Doctors asking a pair of single vision computer only glasses. So then you can work with them oral posture or the body posture. Otherwise, it working against your work. So it's very interesting. I starting to get interesting, learn more about the airway, and the sleeping and the vision. And I reading Patrick McGowan's book, Breathing Cure. I found this is very interesting. He said it's nasal breathing can improve visual spatial awareness by synchronize the brain wave. So he cited several studies. I found that interesting and resonated with me because this is very traditional and a very famous vision therapy procedure. I think if the PT in this group, they know what they for. So this is a box string. And if once I have patient, starting doing this exercise, you starting seeing the mouth breathing, they tense the body, they crunching the teeth, they try to make things, double. But once I always remind the patient, breathe, looking soft. And then it's all of a sudden the 3D is so easy jump out to them. So I found this is connection is very interesting about nasal breathing and visual spatial awareness. This is one of our goal in the vision therapy program, to develop a visual spatial awareness. This picture just bring me attention. I found it so interesting, resonate with me. And I think if you remember, I posted this, try to get more insight from the airway circle practitioners. So as we practice syntonic, actually we not only just by the vision symptoms, the vision findings, actually we look at the whole body. It's called a somatic type or biotype. So we look at the feature of the face, and then we decide which filters is good for the patients. So this is also, I mean, 200 years, I think there is several systems, they categorize the somatic type. So that this system I used is from Dr. Spinkler, also optometry, is a father of syntonic optometry. He is a father of syntonic optometry. So he categorized this face. To me, it looked like an authentic facial feature. So in his book, he described this facial type as a sympathetic dominant person. So this patient has narrow face and jaw. The body is very thin. I think if they under the sympathetic and the fight and flight, then the digestion system might not good absorbing the nutrition. So those people might eat everything, they still cannot put a weight on. So very interesting to me. In his book, he described these people has smaller lung on X-ray. Mouth closed, eye open, bass voice, and crowded teeth. Of course, there's more I didn't put in, but this is very pertinent to our group. This facial, to me, it's a syntonic. The syntonic is a balanced ANS and a square face. I don't know the picnic. I don't know how the picnic fit in the airway health. And those people is a parasympathetic dominant. They have full round face, full lip, mouth open, eye closed, tenor voice. So those people in the somatic type, this is more like a picnic person. I would like, have more insight from your side, but I found this is very interesting. I want to share this. I would like let's talk about vision and ANS. This is very simplified, talk about ANS. But I just bring your attention. This autonomic nerve system actually control the pupil, the eye, the mouth, airway, heart, and all around. If I treating the eye, I treating autonomic nerve system through the eye, I not surprised to me, I can get other effect through this line, around this line. So just bring your attention. So autonomic nerve system and the pupil, sympathetic can drive dilation. The pupil is bigger. Visual field is tunnel vision, the small vision. This is basic of my syntonic practice. This is it's my monitor progress. This testing is very important for me. So accommodation, if you're under stress, you don't have, they have poor accommodation skill. So that's why you see blurry, cannot focusing. Convergence, if you have under stress, your eyes more diverge, you cannot converge. So if you are under stress, basically you're really hard for you to sit, make things clear and single for you. And also dry eye. Dry eye is very common in eye care, but I think if we treating the from root in the nerve system, the dry eye will much easier to manage. Of course, IOP is will increase, will cause the damage on the optic nerve, so that's very severe eye disease, glaucoma. But also under stress will increase IOP. So far, the eye care didn't, use this as a therapy. We still use the drip medication or surgery. Breathing, autonomic nerve system will change breathing rate. Also, the dry eye, dry mouth sometimes go together. I think if we manage the autonomic nerve system, both will getting better. Gland in nose, mouth, and the pharyngeal gland will be, getting dry. And when they dry, they prone to become inflammation. To me, I think large intestinal, large adenoma might from this nerve system again. Speech and the voice, those people getting nervous, they start speaking fast. And the voice is soft, maybe tense. You can hear the voice getting tense. And people can feel, the sympathetic nerve override. So this is my testing, the peripheral vision and syntonic. I use this every day in my practice. It's like a blueprint for the vision function. So I use 4 color. It's very different the visual field testing for glaucoma or the other defects in the regular eye doctor. The one I use is functional color visual field. So this different color field is telling me how those patients function at the physical level, emotion level, biochemistry level, energetic level. Combined with the pupil testing, again, my testing is still very different from the regular eye exams, the pupil testing. This is only detecting the neurology defect. For me, I only want to see how the autonomic nerve system function. So that also can regulate, it can be changed by a therapy called a syntonic. This is the office equipment of a syntonic, but for me, I use the home unit. People doing that at home, come back, I will do every 2 weeks, come back, I take a few, and I took the pupil testing. So when the field is like this is normal field. That's the goal for the syntonic treatment. And then the light is done. We don't need any light. Pupil become very popular, I think, in the research. So early this year, this paper published. It's called "Pupil is a Window of Sleeping Brain." So this is the first time they did a research in human, and they found the pupil size change during the sleeping cycle. That indicate the aroused state in the sleeping. They found before the REM cycle, before that, the pupil starting dilate, which is a long state. And actually, pupil is a window for our health. As I told you, we can look into the eyes, look at the vesicular change in the retina, and the pupil is a window to the soul. Pupil is regulated by the ANS through the light, near work, cognitive levels, sleeping around state we just talked about, and the breathing. As I prepared this presentation, this paper just came out in the right time. So they are talking about the pupillary respiratory facial response. Look at that. Inhale, the pupil is constrict. Exhale, pupils dilate. It's very interesting to me. This is connection through the pupil. The breathing and the vision through the pupil change. Vision actually is at work during sleep. We also know the brain never stops working during sleep, but vision is a functional brain, so vision is at work during sleep. We will accept and process information through closed eyelid during the sleep. Blue light is a very popular topic in eye care and also in the sleeping medicine. Blue light from device can disrupt the circadian rhythm through the iPRG cells. After I learning the syntonic, I learned the full spectrum is the best for eye health. I stopped recommending blue light blocker for my patients. But if you work towards the end of the day, like at night after 8 p.m., 10 p.m., you still have to work on the computer. Make sure you put a PLO, blue light blocker. REM, well, it's a rapid saccadic eye movement. I read a researcher, because as optometry, we only measure those skills while people are awake in the office. We really don't see them asleep. But I read a paper, they talk about saccadic eye movement is same while you are awake and asleep, which I can relate it to what I see in my patient population. When I found that those patients has a poor saccadic eye movement, I can predict them sleeping won't be high quality, because the REM cycle might not, as good as can be. Peripheral vision can keep us on bed without falling off the bed. I hope there is some sleeping researcher here. Please look into vision skills like convergence and accommodation during the sleep. There's no study has been shown those skills also, during the sleep. But I assuming the converging, the eye still can, converge and diverging, or focusing during the sleep. Eye, nose, ear, mouth are sharing the same theory. They are neighbors. I like my colleague and pioneer in our field, Dr. Deborah Zelinsky, put it in this way: the roof of the mouth is the roof of our eye orbits. Any procedure done in the mouth is like earthquake to the eyes. Eye and the mouth are sharing CN5 and CN7. So the published and unpublished case report indicate palate expansion can result in strabismus and double vision. Some case reported change in eye alignment following orthodontic therapy. I think there is just we don't have access behavior optometry, so we don't really look into eye alignment after orthodontic therapy. But I do hear from my colleague, they see some change in there. So as orthodontic doctors, be mindful when you change the teeth and the jaw and the facial structure. They will all change the relationship between the eye and the mouth, and also the body too. Osteopathic and manual therapy applied to the palate can help elevate the strabismus. Patients with TMD often experience vision issues and a balance problem. Malocclusion is associated with higher prevalence of the myopia, which is very interesting for me. I read this article, and I think dentist and optometry definitely should working together, and we can control the myopia. Stutter may relate to the imbalanced autonomic nervous system. Patients also present rapid blinking and even the eye misalignment. When you see your patient for the mild therapy or evaluate the function of the tongue in the area of the mouth, make sure you're looking the whole face and the whole body, see what they're doing. Non-verbal patients starting talk for first time after put on appeal glasses. This has happened times and after times in optometries, and I'm going to tell you what's special about these glasses. So what make optometry special is we have the light and the lens as our medicine. In dentist, make your unique is you have that make the dental implants to the mouth. So we use lens, prism, tint, occlusion, filter, syntonic, and some like vision therapy procedures to treat our patients with vision problem. So lenses are medicine. Optically, lens bend light. As I told you, each point of retina is connected to the brain. If we change the light path and shining different areas of retina, this is basically I can modulate the neural function. This is how I understand those lenses have major change to the areas which cannot explain by the optics. So So the perceptually, lens change the sensory input, then change the output. So the lenses, the way behavior prescribing lenses can affect heart rate, breathing, posture, balance, coordination, and attitude. More and more optometry practice separately, we see the result of those lenses. Just keep in mind, there's two ways prescribing lenses. Not all glasses prescribe for the same purpose. One way is most people go to see the eye doctor, they prescribe pure glasses. Those glasses, I was thinking, we are called is compensatory, as prescription based purely with the 20/20 accuracy. So they prescribe for the refractive error. And the behavior optometry, we do our evaluation with the functional visions, and then we prescribe pure glasses for therapeutical or stress relief lenses. So we consider all the visual skills and even posture, and then we prescribe pure glasses. Why this is important? Because when lenses put in front of your eye, you see things what distorted the space and the time. And look at this is plus lenses. This is the minus lenses. You will see distortion. And this is, I just show you, this is the plus lenses and this bigger. And if you space-wise, the lenses change the spatial. So this is the ball. The ball in the lenses go in sideways or maybe back. And this is the minus lenses. Inside the lenses, outside lenses. It's getting smaller and actually closer. So because, as I said, if you change the input and we'll change the output. So plus lenses can reduce the tonicity of the posture muscular, and then heart rate and breathing. If the patient wear a pure glasses can work against what you're doing, so your therapy might not be efficient. So make sure when you do the therapy, when you do evaluation, make sure that do one with glasses and without glasses. If you see change, just contact the optometrist who prescribe glasses. Light is medicine. We use different frequency of the light, and we try to balance the autonomic nervous system. More and more research has been done on it's called a biophotomodulation. Syntonic is one type of biophotomodulation. So the light can improve the secretion from blood, lymph, and CSF flow, promote wound healing, can increase mitochondrial function, calm the nerve system, remove toxin, decrease inflammation. This is all the syntonic can do. So we also do the vision therapy. It's not eye exercise. It's very different than eye exercise. This is a guided activity. This is my daughter. So he wearing the filters. He using the lenses, and we try to teaching they use the eye. In my program, I do bilateral integrations, visual motor integration, central peripheral integration, and primitive refract integration, and posture and vestibular vision integration. So that's the vision therapy program. I think we have time. Let's talk about a case. Jack referred to me at that time. He is 8 years old and a second grader. He working with his OT, and he referred to me. Jack is under care of his ophthalmology for his amblyopia. He is under several specialists for his gut issue, anxiety, allergy to tree nuts, and sesame. So ophthalmology prescribed a pair of glasses, and Jack struggling in school with anxiety. But ophthalmology said that's nothing to do with his vision. But OT referred the patient to me, and I did all my assessment. I found the lot vision functional vision problem. So birth history, he has emergency C-section, head trauma, Mom reported stitches on head, but nothing serious. Jack has history of ear infection at age 2, and then for 3 months. And then eventually they put a tube in the ear. Since then, Jack struggled with chronic congestion and takes Zyrtex daily. Jack is on ADHD medicine when he sees us, and he sees the therapist for his mood regulation twice a month. This is a very typical presentation when patients come to us for the help. So this is the field. The first actually we're taking was Jack. This field is not too bad with the size, but look at the distortion of this field compared to when finished the syntonic. The field is more, expand all the colors, and also you're more regular, and the blind spot in the right place. So this field, the initial field, tell me Jack is suffering with neuroinflammation, anxiety, maybe had a head and neck trauma. So further vision diagnosis, Jack had eye strain, visual spatial deficit, refractive amblyopia, and intermittent eye turn. This is the eye turn in. These two ophthalmology already diagnosis. And poor psychotic eye movement, binocular suppression, and visual field constrict. So I'm treating all this visual problem with syntonic, and see what mom share. This is after syntonic, 3 months syntonic, and we got the field open. We finished the syntonic. So mom report at the very first night using the blue-purple lens, which is anti-inflammation program, light program. With the first minute, Jack said that he felt like a bloom slowly popped in his forehead, and he felt calm. He fell asleep to his light every night. Mom said, I noticed the bedwetting accidents reduced, and he seemed to have a deep sleep. Many people notice his chronic congestion disappears. He become a strong reader and start to have better mood regulation. The full article mom read I post on my website. So I have several patients share this syntonic experience. And also, after a course of syntonic, Jack is off his daily Zyrtex for his congestion. After syntonic, Jack worked diligently with our office in integrated care program to improve his vision skills. He started to thrive in his school. He graduated off his ADHD medication during the VT under supervised with a prescriber. During the VT, Jack come in and show me his palate expander. He told me he has something in the mouth and showed me. At that time, I have no idea about this, this field. So, but very soon after, mom shared with me, he sounds like Jack starting to have some symptoms return, and we continue work with the vision therapy. And then we basically finish the therapy in the summer. During the summer, Jack continue work with the orthodontic and put the brace on his teeth. After summer, he returned. Mom very concerned about his the visual skill will regressed because in the summer we don't do any therapy in office. And also he also struggling and seeing other specialists about some blood testing is very concerning to them. So we continue with work with his the vision therapy, and then I think getting better. They still follow up with orthodontic dentist. Now I think Jack also starting have some sleeping work, and then now he is seeing the sleep specialist. We still continue work with him for more vision skill development. This is how we should correct it and collaborate and talk to each other with the dentist, with the allergist, and also the myotherapist, sleeping medicine doctor. So more information about the behavior, I have listed all this resource. I don't think I have time to go through. And this is selective reference. articles and the book, very helpful for you to read through if you like to understand more what I'm talking today. So I hope at this point you have better understand about the vision, what optometry can do, and how you can collaborate. So now what? Go out and connect with behavior optometrists and with the like mind in your area. So so that's it. Thank you for your attention. Any questions? I'm happy to connect to anyone who interested in integrated care. I might connect contact information here.
Thank you, thank you, thank you. This was a much needed talk. This was wonderful. Thank you so much, my Lord. When I was super young, I don't know if I was about 10 years old, I've always had astigmatism. And my
Okay.
mom took me to, there was only one lady in my whole vicinity area, part of my state, I think, even, that did it. She was an older lady and she did vision therapy. And I remember going and she would ask me to look into these things and tell her what I saw. And oh my gosh, she was mean. So I remember not continuing. But however, throughout my life, I've had tons of vision testing done, and sometimes you show that I have astigmatism, and sometimes it doesn't. Is that normal?
It is normal. Since astigmatism is just a state of your mind. My understanding of the vision is very different than other optometry. And I understanding astigmatism is very, very different now after I learning all this. Yeah.
Wow, this
All
is
the
so
refraction
fascinating.
area is a state of your mind because
Oh,
vision is through your mind and body.
that's insane. And of course, after my that's always crooked. After having MARPE, which I had MARPE at like 38 years old, 39, my
Mm.
vision went.
You probably need to see the vision therapist, behavior
I
optometry.
need
Yes.
it. I mean, I'm watching you explain all of this, and I'm like, yep, that's me. That's me. I need to have this. So I might make a trip. My goodness. I go
Yes,
back to what
get
I
out.
said earlier. We need to do like an airway circle bus and just visit all of these incredible professionals all over the place. You guys are amazing. All right. I'm gonna ask some questions. Some of these you might have answered them already. However, I want to put this on social media. So here we go. How does vision health influence sleep quality and breathing patterns?
So as I told you, when you have vision stress, you can doing this, right? All this the posture you try to fix.
I'm
But
doing it right now.
think about, the again, as a behavior optometry, I think in the function changes the structure, right? And then if you doing this for 8 hours or 16 hours, a day, and think about you cannot do the properly in the sleep. So that will cause the sleep apnea. I was thinking that's probably the connection. And also, I'll just share with you the rapid eye movement. I don't
Mm-hmm.
test the people in the sleep, but people come to me, they are awake, the eye movement is not good. So that's why syntonic sometimes after I balance the autonomic nervous system, the eye movement is much better, all the skill much better. And the patient
Mm,
first thing they reported to me is sleeping getting better. But I said,
wow.
I don't know you have sleeping problem. So now I ask him, how's your sleep for all my patients? And actually this deep, some patient has wear the Fitbit and they tell me it's showed in there. The IEM cycle getting shorter, it is longer or just, percentage is higher.
That's so interesting. I know Anne said this is so informative. We haven't had a talk like this in our area circle library yet. We have not, so we're so excited to be able to share this with everybody.
Yeah.
We have another question. Can you elaborate on what visual hygiene is?
Okay, so visual hygiene is because our eye is not designed for the near work. So so the one of the hygiene, so we have to take a break. So for
Mm,
me, I would say breathing. A lot of time, this is become stress. They just stop breathing or shallow breathing, and those post posture is just interference with them proper breathing too. So
mhm.
the proper posture for the vision hygiene, keep breathing, uh, take a vision break. So basically, is breathing. What to say? a soft gaze, and make sure when you look at the screen, you are attending the other, like peripheral. So have the peripheral cure. So yeah, breathing, blink. A lot of times they don't blink.
Wow.
Yeah, so there's 3 Bs: breathing, blink, and take a break.
Take a break. I
Yeah,
love
there's
that.
20, 20, 20, 20. There's 420 rules for the hygiene. Is 20 minutes. Take a 20-second looking far away is 20 feet, and maybe you can take some movement, like 20 step, like so. Yeah, movement break during the using computer.
I had a tick when I was younger, which it's probably slightly better, but still there a little bit, which was blinking like this.
The blinking.
Why do
Yeah.
kids do that?
So because that is also sympathetic nerve system blinking. Yeah. So we do have some lenses help. You probably need a stress relief lenses.
These are the most expensive lenses I have ever purchased in my whole life. They were almost $1,000
Okay.
without insurance, but because it was,
It's a neuro lenses.
I think so. I'm not sure the
Okay.
name. I'm awful.
It's okay. Yeah.
I just say, yeah, that's fine. Whatever I need. I don't understand about it, but let's go. But it's a special kind of lens, I think, that it does. It's mainly for clothes, but it does a little bit also, which I can see from far away, kind of okay, mostly okay. But
Mhm.
they added for this one on both, and it's so much easier. However, I take this out and I can't see anything.
Okay. Yeah. So again, any lenses will change the space and the time. So I don't recommend using the glasses for full time wearing, at least half an hour. If you cannot just take off your glass, half an hour just to have the eye experience
Yes.
without it.
Yeah, because it's stuff I've noticed that the more I wear it, the worse it gets. That when I
Because
take it
the
out, I
brain,
can't read my cell phone anymore.
it changes your brain function.
Oh, shoot. And then the MARPI also might have messed it up. You mentioned a little bit about palatal expansion affecting your vision. Can you touch a little bit on that? Whenever you expand the maxillary bones and you split that suture again, what is it doing to the eyes?
So as I said, anything it's the floor, the roof of the mouth is the floor there, right? So early years, I had no idea about this. Early years, I keep hearing the pioneer optometrist keep talking about you send the patient, strabism patient to the osteopath or craniosacral. When they're doing this gentle touch in palate, the eye muscle, will straight the eye for strabismus. I have no idea, but now I understand because the roof of the palate is the bottom of
The nose, but the
it's
roof of the
yeah,
nose
it's
is the
the
floor of
floor of
the
the
ocular.
orbit. But if you look at this, the orbit, it's like I have a picture in my slide. So it's like this, but sometimes the muscle is the trapped.
Mm-hmm.
But if you change it down there, I don't know the orbit of the bone, how the bone change. So it's just a change the relationship, the bone's structure in the
Mm-hmm.
orbital bone structure for the eye, but also you can change the skull and also the body, the relationship. So that's my
Amazing.
understanding.
Okay. Is this helpful for suppression of myopia development?
Which one? So the vision therapy program or is the palate expanding? What's the
Oh, I think the vision program.
Yes, yes. But again, there is several ways you can do myopia control. But my way is very different from that, from like normal, like a regular eye doctor. They use
Mm-hmm.
more like ortho K, atropine. But I think myopia is developed because those kids don't have vision scale. So if I help with the vision scale development, and the myopia will be, at least reduce. I have
Mm-hmm.
very confident the vision therapy can help with myopia control. It's just a way they don't know how to use the vision, and then cause this. It's the state of the autonomic nervous system. Everything I go back to the basic.
Yes, and going back to the expansion, I have heard of so many young patients getting palatal expansion and vision getting better. Now, there's always a lot of questions that come to be about MARPI, and I have seen both ways after MARPI vision getting slightly worse or slightly better, not changing at all. But I don't know yet of any research or anything that people are working on to see, really be able to compare this amount of changes to vision changes.
Yeah. So if patients tell you the vision getting better or worse, to me, I don't think, it's really tell me it's just acuity because people don't know how the eye move or this. So it's better to send it to behavior optometry. So really looking at how the function works. But for them, they only see that central vision, right? So then I think it's better we work together. Once we send the patient to you because we really see those face shape. In all my patients with a vision problem, like a narrow, crowded teeth, there is something definitely there's some relationship there.
Can you change your vision when you change your posture?
Yes, of course. That's my mentor, because I learning along the way. I still learning every day. So once my mentor, pioneer, Dr. Pajda, he tell me that, so, if I straight, I'm upright, so I can converge, up to the nose. Otherwise, you can't because you cannot really doing breathing, oxygen, nutrition. So now I understand. At the beginning, I don't understand. But now I really understand the posture. It's really like going two-way with the vision function. Yes.
Somebody else asked, how does stress relief lenses work?
So stress relief lenses basically is behavior doctor, optometrist. So they test and see with this is our optometry tool like a retinal scope. So we by looking at it's called stress point or different, it's a near retina scope. Most doctor they don't use these tools for prescribing, but behavior optometry we actually use. So it's very little, very small amount of the prescription. Most is plus lenses. What the plus lenses do, I'll show you. They increasing the distance perception. They can make things bigger. So they just help you see things much easier.
Wow.
So also relax the accommodation, help your accommodation or relax accommodation. Yes, the focusing.
Amazing. And the test, when you ask to focus on the pencil, what is the interference when it feels stress?
So that
Go ahead.
So that means your eye can have no ability to converge. And think about this is just a pen tip. Think about if you're reading the words, you have more cognitive skill have to using those eye. Yeah. So eye movement and this MPC just take less than a minute is very good tool for screening your patient for this vision problem. Yeah. So
okay. Go ahead. We're asking them if they're feeling tension.
So if they're doing this, if their attention just looking at that, so that tell me. So once in the computer, that's not comfortable or reading book, and maybe only 5 minutes. That's it. They cannot pay attention to anymore because it's all tension. So headache, dizziness, sometimes nauseous even after reading. Yeah, falling asleep is another symptom.
Wow. Every time that we do anything like this, I remember Dr. Martha Cortez, who is just an incredible forever legend in this airway field. And I remember her teaching me just whenever we were having dinner together one day in New Jersey. And she said, once in a while, you can just look away from your computer and you do this and you go like this and like this to kind of give your eyes a little bit of a rest and look away from the screens. But we miss Dr. Martha. And yes, and I think
when you move the eye, it's not eye exercise. You know what? It's the brain. The whole brain is because look at that. CM3, CM4, CM6, they are like designated for only eye movement.
Wow.
Whole brain.
I got goosebumps everywhere. That was great. Whenever you do eye exercises, they're not eye exercises, they're brain exercises, people. And we all need brain exercises. This is fantastic. And now the one question that I know it's in everybody's minds right now, where can we find professionals like you?
Okay, so I involve it's called the OEP, is Optometry Extension Program. I got most of my education there, so you can have the doctor localized there, and also I also involved in the College of Syntonic Optometry. They also have the doctor localization there, and all over the world. It's not only U.S.
Mm-hmm.
But if you are, particular areas, I can help you to localize, a practitioner who practicing this. Yeah, so, and also the Facebook I list up is called Vision Therapy Parent Unite. So if you post mm, the zip code, somebody
Uh-huh.
will find somebody for you. Yeah, so.
That is fantastic. Well, thank you so, so, so much. This has been so insightful. Any last words before you go? Do you have any books or courses or anything that you'd like to share? How can people find you?
So yeah, I'm practicing in Connecticut. I wish I got, more patient and I mean more practitioner to understand that this is a vision and collaborate. And if you are near me, hope and feel free to reach out to me. I'm really happy to connect and we can work together. Yeah, again, I would, more people learn about this behavior optometry, and it's there for 100 years. It's just not
Mm-hmm.
popular.
I do have another question. Is there any way that I could come in with my kids for an evaluation and being treated at home? Or do we
Uh,
have to come into the office?
so it depends of the office. You have talked to the doctor. At least the assessment for me, I only do the in office.
Person,
Part
yeah.
of my program, I can do virtual. So
Okay.
but part of them, I have used a lot of equipment. I have to go to the
Mm-hmm.
office. But but foundation scale, I don't need the equipment, but I understand how the vision development and go from there. Those I don't really need equipment. So it's synchronic,
Okay.
the same thing. So most of for me is a home therapy, but I have to
Mm-hmm.
have the in-person measure the field, and then maybe yeah, we can do some. For me,
Mm-hmm.
is some portion which therapy can do the home.
Amazing. All righty, everybody. Have a wonderful night. Thank you for hanging out with us today, and we will see you next week. Don't forget to bring a colleague next time you come to an Airway Circle Live. Thank
Thank you.
you. Bye.